Today on the Daily Challenge, we're going to be talking about ACL injuries. We will cover what an ACL injury is, what causes it biomechanically, and the new findings and how that impacts recovery and prevention in the future. So first, we need to know the anatomical structure of the knee and where the ACL is located. The anterior cruciate ligament, also known as the ACL, is a ligament that attaches from the anterior portion of the tibia to the posterior portion of the femur. This ligament is important in the stability of the knee. As you can see, the knee segment is mainly covered in ligaments. There are no muscles around the joint to cushion a blow upon impact, so it makes the knee more susceptible to injuries when they occur. So what does cause an ACL injury? It usually occurs due to the anatomical disadvantage of the knee and improper biomechanics from the athlete. ACL injuries aren't only caused due to contact. Commonly, an ACL tear occurs when there is a sudden change in motion of the upper body relative to the knee segment, which places the center of mass out of alignment, causing the ligaments to be vulnerable to the extreme amount of stress outside of the natural alignment. Scientifically, we can use a stress-strain curve to further break down how ACL injuries could occur. When there is a sudden change in motion, there is a workload or stress applied to the ACL. The combination of both the displacement of the natural positioning of the ACL and the increase in the stress load applied causes the ACL to reach failure. At this point, the ligament cannot withstand any more load, causing it to tear. On to the new findings. Researchers have found that there are possible neural imbalances that puts the body at a disadvantage and increases risk of an ACL injury occurrence. To increase the understanding and improve prevention, scientists have come up with risk factors that can be strengthened to avoid injury. Some of these possible risk factors are having a high BMI, even if it's more muscle than fat. Also, ligament dominance, which means the ligament absorbs more shock upon landing than the muscle do. Also, a quad dominance over the hamstrings, the leg dominance, or a core dominance that can throw off the alignment of your body. Some skills to improve the overall outlook of ACLs are improving landing techniques, strengthening the posterior chain of the ligament, and also improving symmetry and core stability. Overall, recovery could take anywhere from 2 to 6 months, maybe even 9 months, to regain the full range of motion. In recovery, the main goal is now to target and reduce pain, increase range of motion, regain level of strength prior to injury to address the previous disadvantages and the problems around the knee segment. Scientists say to approach the healing process by exercising and improving the neural imbalances that possibly caused the injury initially.